We're diving into asthma triggers and Asthma Peak Week, that time in September when asthma attacks start to spike. Today, we're focusing on why fall can be an especially risky season if you have asthma, the most common triggers to look out for, and how you can prepare so you can keep your asthma in control all season long. This podcast is made in partnership with the Allergy and Asthma Network. We want to thank AstraZeneca and Amgen for sponsoring today's episode. While they support the show, all opinions are our own and sponsorship doesn't influence our content or editorial decisions. Any mentions of brands is for informational purposes only and not an endorsement. Now let's get to it. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
So today we've got Kristin Sokol, who is a good friend and an allergist. So Kristin, could you introduce yourself for the audience?
Sure. My name's Kristin Sokol. I'm an allergist immunologist, and I am working in the DC area at Schreiber Allergy. I'm just happy to be here. So thanks for inviting me.
Thank you so much for joining us. Today we are talking about asthma. So I know this is something that an allergist also sees. And if you could explain what asthma is and maybe why it falls under an allergist as well as a lung doctor or a pulmonologist.
Yeah, so allergists see a lot of asthma in all ages, from pediatric to the very old. And that's because one of the main triggers of asthma is actually allergens in the environment. We know asthma very well. Asthma is a chronic inflammatory disease of your airways, and symptoms can include wheezing and coughing, shortness of breath, also chest tightness. And asthma can range from very mild to serious life-threatening disease. And so symptoms of an asthma attack can occur when inflammation, that airway inflammation, combines with a trigger or an exposure. And asthma is often needed to be managed with medications, both controller or preventative medicines and rescue inhalers. And now there's some newer biologics as well. And of course, avoidance of the triggers is super important.
Amazing. Well, that is exactly what we wanted to focus on today is triggers, really, is to understand what is causing our asthma. Just a quick understanding of what asthma is. It's basically inflammation in the lungs, correct? And that's what makes it hard for you to breathe?
That's right. It's a mixture of inflammation and then bronchospasm in sensitive airways. And that just means that our small airways in the lungs are kind of spasming up, and that causes even worse inflammation.
And that's why we have different types of medications. We have medications that help with that inflammation or that swelling in the airways. And then we also have medication that helps loosen those airway muscles that tighten up more easily or spasm, as Kristin had mentioned. So that's really what asthma is two different things that are happening in your body, and then they are triggered by different factors. What we're talking about when we're talking about a trigger is something that can cause your asthma to worsen. So asthma is not always acting up in your body. So if somebody has asthma, they may not have symptoms for days or weeks or even months, ideally. But if they're exposed to something like an asthma trigger, and these can be various things like allergens, irritants, infections, exercise, or weather. And we're going to go into each of these a little bit more because that's really our topic today is triggers and how that can affect asthma.
Great. So you mentioned a quick overview of those triggers, Dr. G. Can we dive in a little bit deeper into what exactly those are? So like you said, allergens, for instance. Can we dive into a little bit more specifics and then more specifics of all of the other things that you mentioned?
Sure. I mean, I can take this on. As I mentioned at the beginning of this session, that allergists are very well versed in asthma because allergens are a major trigger of asthma. And these can include things like indoor allergens, so dust mites or molds, or pet dander, so cat and dog dander. It can also include outdoor allergens, so when the pollen counts are really high outside, also mold in the outside as well. So when these allergens are in abundance and we're allergic to one of these allergens and we're exposed, then our asthma can be triggered. So these allergens can irritate our airways and trigger an asthma attack. Another trigger of asthma is something that you're not allergic to, but can be very irritating to the lungs as well. And these include things like cigarette smoke or other types of smoke, strong odors, so perfume, cleaning products, and then just pollution in the air as well. So a lot of patients tell us that their asthma is triggered when there's wildfires coming from northern countries or northern cities, when the air pollution is really bad, when those UV indexes are really high and they have have those warnings on your phone that it's not great to be outside, those kind of days can trigger asthma. A very common trigger of asthma, especially in kids, is just having a common cold. And this is often overlooked because even just a mild runny nose actually can trigger asthma to flare. Of course, other viral infections like flu and RSV and COVID. Exercise is a big one, especially in cold, dry air. So if you're outside exercising in that cold, dry air, this can trigger an asthma attack. And then we talked a little bit about air pollution, but also other types of weather. So sudden temperature changes. So going from very hot to very cold weather or vice versa, very high humidity. And there's actually something called thunderstorm asthma. So thunderstorms can trigger asthma in some patients as well.
Yeah, I love this thunderstorm asthma as a like weird trivia thing for people to know. Like, did you know that you can have an asthma attack in a thunderstorm? But that's like one of those weird things that trigger asthma. Is there anything else that's like a surprising trigger that's not so obvious, like perfume?
For me, one of the ones that people don't really understand can make asthma worse is emotional stress. So, monitoring the amount of stress that you have in your life can also be really important when you have asthma, and doing things like meditating and exercising to help with that level of stress that you might be having in your life can be really important. And I think oftentimes people don't correlate those two, so they don't really understand what's causing their asthma to get worse. But emotional stress can also trigger asthma. And so that's really important to remember.
Piggybacking on that, other types of emotions can actually trigger an asthma attack. So that might be a surprising one. So if you're laughing really hard, if something's really funny and you can't stop laughing, that can actually trigger an asthma attack. Or if a child is having a temper tantrum and they're crying and they're hysterical, that can trigger an asthma attack. So sometimes those high level emotions can trigger irritation of the airways.
Okay, that totally happened to me when I was a kid. I used to just get hysterical and then like could not breathe. And my parents used to have to like give me a little pat on the back to get me going. And then, eventually I started using an inhaler when I got diagnosed with asthma. But it was always like, don't let her get hysterical because the repercussions are never good. And I was like one of those kids who could not stop laughing. And yeah, the results were never very pleasant for anyone. So besides the fact that like you just don't let the kid get hysterical, how do you avoid these triggers? I mean, Dr. G, you mentioned stress as a trigger and meditation and just trying to find some calm within the storm of your life. How about things like allergens or things like the cold viruses? How do we avoid our triggers?
I think that getting allergy tested can often be helpful for people, and going to somebody like Dr. Sokol or myself to get tested and understand exactly what you're allergic to so that we can help you with environmental control measures. And what we mean by that is if you do have a pet allergy that you've been trying to ignore, understanding that you're allergic to your pet doesn't mean that we are going to tell you to get rid of your pet, but doing things like not allowing them into your bedroom is super important because that can be your safe space. Having an air purifier can also help with pet dander. And so doing some simple things like that can help. And then if you're allergic to pollen, so that's tree pollen, grass pollen, or weed pollen, doesn't mean that we don't want you to go outside. But on days where the pollen counts are higher, that might be the day that you're not going to exercise outside, right? Monitoring the pollen counts and knowing that those are your allergens can help you understand better what's going on so that things don't feel as confusing.
It sounds to me like you have to know your triggers before you can avoid your triggers, obviously. So, going to see your doctor and maybe keeping a journal of when your asthma is not doing well. Is there anything that's actually telling you, if it's not so obvious right off the bat, that whenever it's smog outside, you have a hard time breathing? So, just trying to keep a journal of when do you have a hard time breathing, and then you can figure out your trigger with your doctor. And then once you figure out the trigger, it's not easy to always just completely avoid things, right? We can't just create our bubble around ourselves, but we have to find ways to lessen our exposure to those triggers. So if you have a pet that you just can't get rid of, find a way to get that pet dander under control. So using a filter, not allowing them in certain spaces, not allowing them in rooms with carpets, for instance. That's what we did in my family when I was a kid. Our dog wasn't allowed upstairs where there were carpets. And there are other things like if you know that the pollen count is high, we have wonderful apps that tell you what pollens are crazy outside right now. Maybe don't go outside. One other thing about the fall, as we enter a time where it's going to get cooler, is that you mentioned a trigger can be changes in temperature. Is there anything that someone can do if they know that temperature changes like the cold are a trigger for their asthma?
Sure. So going into the fall, we know that temperatures can drop really quickly. So those days that become really cold and dry out, we can wear a scarf or a mask over our mouth and nose if we're going to be outside for a long period of time, or we're transitioning from like the outdoors to indoors really quickly. Using a humidifier in dry indoor environments can help. And then if you know you're going to be outside for a prolonged period of time during those days, to warm up slowly. So if you're going into exercise, not just going from an indoor environment and then going for a long run, doing that very quickly can trigger an asthma attack.
And you mentioned exercise, and that is another form of trigger, right? So, what can you do if you have exercise induced asthma?
Yeah, so exercise can also cause the airways to get irritated or triggered. What we want to do for that is oftentimes, if exercise is a trigger, we can do a rescue inhaler 15 to 30 minutes before exercise, and that helps prepare our airways for that exercise that we're about to do. We also want to warm up and cool down properly. So we want to do some stretches, make sure that we're doing some light exercise before going right into heavy exercise, and then make sure we're also cooling down. So all of those pre and post exercise routines that a lot of trainers will put into place, they're really, really extra important for people with asthma. As I'd mentioned earlier, avoiding outdoor activity and maybe doing your routine indoors on days where the pollen counts are really high or where the air is really cold can also help if you have exercise induced asthma that is also worsened by cold air or pollen or allergens. So you just want to make sure that you're paying attention to those things.
So, I love to skip warming up and cooling down, but if you have exercise induced asthma, you're not allowed that privilege. You have to prepare your body for it. What about other things though? Like there's viruses you mentioned, there's perfumes, there's smoke, there's things that we just encounter that we can't necessarily just shut out of our lives.
So for the indoor triggers you mentioned, and some of the outdoor ones too, that we can't just avoid, right? We might be in situations where those triggers are just all of a sudden in our face and we weren't expecting them, like cigarette smoke, or you go outside and the air is very heavy. We just want to remove ourselves from those exposures as much as possible. So usually if a patient encounters like a very strong smell, cigarette smoke, cleaning, perfume, etc., just removing yourself from that situation is very important. Being in an enclosed space with your trigger is going to make things worse. Unfortunately, we're not going to completely avoid these triggers. Like we said before, we can't live in a bubble, but we can try to remove ourselves from those situations. And then of course, viruses. So viruses are going to happen, right? Everyone gets viruses at some point in their lives, and little kids are getting viruses all the time. So just monitoring that, right? Good hand washing, getting your flu and COVID vaccines every year, avoiding close contact with sick people. If a lot of kids are sick at school, you might want to be keeping your child home during those times if they have asthma and you know illness is one of their triggers. Considering masks during peak illness season in the fall, that viral season is really important. So we might want to consider masks. And then, of course, we can increase medicines that control or prevent asthma attack during certain viral seasons. And that's something you should talk to your doctor about if this has been a concern for you in the past.
Yeah, and I think that this really lends itself well to talking a little bit about Asthma Peak Week, which is a time of the year when we really are seeing a lot of these things come together for this perfect storm. And essentially, it's during the time of the year when everyone's going back to school. And that is when we're getting that higher exposure to people with germs and those viruses. And so that's one of the reasons. It's also a time when pollen counts for a particular type of allergen called ragweed is also higher. And so that can also really trigger people's asthma if you're allergic and you have allergic asthma. And then oftentimes going back to school can be stressful for children and adults. And so that stress can also worsen asthma and be a trigger for some people. So those three big things, the increased infection, the stress from going back, and then pollen season can all culminate to people having worse asthma. And that's what's called Asthma Peak Week. We want to make sure that before that time hits, that we're really having that visit with your regular doctor or your asthma doctor, which can be an allergist or it could be a lung doctor called a pulmonologist. And during that time, we want to make sure that your asthma is under really good control. And so I just want to talk about control really quick. Control is meaning that your airways don't have as much inflammation or swelling. And we do that by taking the right medications that control that underlying inflammation or swelling. When you have asthma, you want to make sure that that inflammation is always controlled, because if you get exposed to a trigger and you already have underlying swelling in your airways, that can be even worse for your asthma.
What I'm hearing is that peak week is kind of like this culmination of things that come together. And you talked about two things, Dr. G. You talked about the reason why we see in September a huge rise in asthma attacks and asthma visits in the hospitals. And that's because viruses, pollen, and stress. So just like a change of routine from summer to now you're back in school kind of situation is happening. And that all kind of creates like this perfect storm for having an asthma attack. And if you don't have controlled asthma, which is the second thing you talked about, this asthma attack could be worse. And what that means is like if your body is already a little bit inflamed and you encounter something that is a trigger for you, that inflammation can make an asthma attack even worse than it potentially would be. So what I'm hearing and what I'm thinking, and tell me if I'm just like jumping to conclusions, is that say, you have the pollen allergy and so it's bothering you a little bit, but it's okay. You can go by. It's just like a little bit uncomfortable. But then all of a sudden you get a virus because you already had that little bit of problem from the pollen. That virus makes your asthma worse than it would have otherwise been if you hadn't have had that little pollen underlying inflammation. When your asthma is not controlled, you can have a worse flare, and that's how this lends itself into asthma peak week.
So you're completely right, Courtney. So the sudden exposure to these multiple triggers at once can cause asthma to flare. So it's really important to have those visits, get the asthma under control prior to asthma peak week. And hopefully that will lend itself to control during that time.
Can I add one more thing? Because I was just thinking about this because we talked about medication, and I know that I have a story of a family member who went on vacation and they got lazy with their use of medication. And when they got home, all of a sudden their asthma was so much worse and they were having flares more often and they had to go to their doctor. So is that something that can also be a problem? Is like in the summer we get lazy with our routines, and that's maybe one of the reasons why people can have more asthma attacks in the fall?
Yeah, and really that can happen at any time of the year, unfortunately, where we kind of fall out of routine and we're not taking our regular medications that we should be taking. But as you mentioned, during asthma peak week, when all of these things are coming together, it's even more important that we are really staying on routine and making sure that we're using all the medications that we're supposed to. And that stands true even for kids that have viral induced asthma during the winter time. That's really going to be the roughest time for a lot of children. We want to make sure that everyone's on top of all of the medications that they need to be taking. And as a parent, I can tell you that's not an easy task. You're trying to keep on top of a lot of different things. And so sometimes keeping on top of the asthma medications just is another thing that can get lost in the mix. So yes, it's a lot for anyone with a chronic illness to keep on top of their medications. But during this particular time of the year, and it is even more important that we're really staying consistent and on top of the medications that we're taking that control that underlying swelling in our airways. And also what Dr. Sokol had mentioned earlier, we may put you on more medication during that particular time of the year to control the swelling in your airways, because we just want to make sure that everything is as clear as possible for these extra triggers that cause your asthma to flare.
So, on top of that, what you just mentioned, Dr. G, what else can people do to prepare for this fall asthma time?
Yeah, so as we mentioned before, meeting with your doctor that cares for your asthma is really important at certain times of year, but certainly that late summer, early fall meetup is important right before school starts. What the doctor can do is try to take some burden away from the family to be in charge of different medicines and kind of know when to give those medicines, because it can become very confusing. And if you have multiple children, right, you're trying to take care of a lot of things, different medication plans. So one thing the doctor can do is provide a personalized asthma action plan. And we do this for every patient with asthma, no matter what the age. It's a personalized plan created with your doctor. It's individualized for each patient, and it helps recognize those early warning signs for each patient. And it lists out their potential triggers. So that might include tree pollen or grass pollen or weed pollen or pet dander or strong smells or humidity, whatever it may be, they can be listed out on that asthma action plan. It helps recognize those early warning signs, and then it tells us what to do when those warning signs are in effect. So in each asthma action plan, there's 3 zones: a green zone, a yellow zone, and a red zone. And the green zone is kind of just like when you're feeling good, you're not really having any triggers. The yellow zone is when either you're sick or you're exposed to some triggers, and then what to do during that time. And then the red zone is the danger zone. You don't really want to get ever into the red zone. So if you get into the red zone, we'd still list what to do in that red zone. But hopefully with a plan in place, we never even get there. And this asthma action plan, I tell patients to put it up on their refrigerator, make copies of it, and this should be shared with the schools or with any other caregivers that are watching your child.
Yeah. And during that visit, it's really important to talk to your doctor about filling out any forms that you might need for the school. So communicating with the school, making sure that they know that your child has asthma and understanding what those symptoms might look like. The controller medication, usually you give at home, but certain schools, if the families have a hard time doing that, can also do that controller medication at school if that's going to make it more predictable and it's going to make it easier for the family to do that. If they have a school nurse, they can sometimes have that medication be given at school. So that's also an option for some people. And so just keeping those things in mind and finding ways to make all of this easier is really important.
And always remembering that, going into the school year, you want all your inhalers up to date, right? Nothing's going to expire soon. So that's something else the doctor can check on during that time that you meet with them. And sometimes even patients with very mild asthma who really don't have a lot of flares, right? They might only flare once every couple months. They forget if their rescue inhaler is expired. So always remembering to look at those inhalers, look at the expiration dates, and making sure either to call or meet with your doctor to refill those.
Yeah. And also knowing that you can get multiple inhalers if you need them. So a lot of families will be really worried because they don't know how to account for maybe even 2 households, right? If you have 2 households and you need extra inhalers so that you know that they're available at both places, your doctor can also prescribe multiple prescriptions and hopefully insurance will cover that. And oftentimes they do.
That's great to know. Thank you, Dr. G, because I think that sometimes you don't think you're allowed to ask for more than one, but practically it's nice to have one maybe at work and one at home. Or you never know. I personally always like having a backup because I guess the worst case scenario, your purse gets stolen and all your medications are gone. What are you going to do? And it's like a Friday. That's always the worst case scenario I have in my head. So I always try to have at least one backup if I'm able to get that from my doctor, which apparently you are. So that's great. I just know my insurance would be like that nice.
Usually we can write in the prescription. So the doctor will write under in a little note to the pharmacist, patient requires 3 rescue inhalers. And often I'll just write it right out. I'll write one for home, one for school, one for travel, or one for mom's house, one for dad's house, one for caregiver, something like that. One for home, one for work. So we can do that in prescriptions. Now, of course, we don't dictate what happens with insurance, but that does help.
That's super. Honestly, I feel like that's really cool because that's something we don't talk about enough is just like knowing that we have more than one medication and where those exist. So thank you for that tip. That's a really nice tip. The other thing I would love to mention, because now I've become a calendar person. I was never like a phone calendar person and now I live by it. Is whenever I get a new prescription, I put in a month before it's expiring, like a notification for myself, just so that I know I have to head up my doctor to get that medication looked at, especially for my rescue inhalers, because thank goodness I don't use them very often. So I totally forget about them in terms of like getting those updated. Whereas like with an epinephrine device, I always know because I just have that in the back of my head, but my rescue inhaler somehow dropped to the wayside. So I just like to give that little tip of pop that right into your phone so that you know when to hit up your doctor for a new prescription. Thank you so much again for reminding us about asthma triggers and how to avoid them. I know that sometimes I get a little bit lazy and I forget about certain protocols and then it comes and bites me in the bum because I encounter a trigger and I'm not ready for it. So thank you for reminding us once again what those triggers are and why we want to avoid them as much as possible. So just to close out this episode as we slowly enter September, what's one tip you would love our listeners to take with them when they are thinking about their asthma and entering the fall season? Let's start with you, Dr. Sokol.
So I want to reiterate that asthma can be well controlled. So some patients with asthma, they think, oh, well, I have asthma. This is always going to be a problem for me. But it really can be well controlled with the right tools and the right plan. And speaking with the doctor that takes care of your asthma is a really important key in this.
I love that. Controlled asthma is such an important thing. And we have lots of episodes that I'll link to where we talk about what controlled asthma is, because you don't have to feel like you're struggling to breathe all the time. There's so much out there for you. There's so many new medications that will help you. So definitely, if you're feeling like you might have uncontrolled asthma, check out some of the episodes that we'll link in the show notes. And Dr. G, what's your final takeaway?
So I think that what is also important is making sure that the moms and the dads and the caregivers are paying attention to themselves, and even teachers, right? So I think oftentimes we're focused on the other person that we're taking care of, but people and adults oftentimes don't take care of themselves. So making sure that you're really checking in with how you're feeling and how your health is doing and how your asthma is controlled is super important, because if you're not feeling well, if you're sick, you can't really caretake for anyone else. So just remembering that and focusing on everyone's healthcare and not just people that you're caring for.
Amazing. Thank you both so much. I feel like this is an episode I will be sending to certain people in my life because we forget as adults or as caregivers to take care of ourselves, and also that the summer is super nice, relaxing time for a lot of people, but we get a little bit too relaxed and we're not prepared for the fall. So I feel like this is a good reminder that unfortunately asthma doesn't go on vacation like we get to, and we have to remember that.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.